Hi guys, I'm Talisha, one of the master estheticians here at St. George Med Spa, and we thought we'd do a quick video on all things Clarity Laser. So this is our machine and awesome, it's always busy here at the Med Spa. It does laser hair removal, it does photo rejuvenation, which is for pigment, it does vessels in the face at the same time that you can do photo reju. It does spider veins on the legs. It's wonderful, it's a great machine. So here, with my cute client Chelsea, I'm going to do an underarm laser hair removal so you can see how it looks. We're going to ask Chelsea how it's feeling, and so we can kind of relieve some of the anxiety that some people have over lasers and if they are super painful. So here we go. We're going to start here on the underarm. You're going to see a cold cryogen spray come out. We're just going to go along. We can go as fast or as slow as the client wants. Chelsea, how's that feeling?
It kind of feels like a little rubber band flick.
Okay.
But it feels actually cold to me.
Okay, perfect. So on a scale from 1 to 5, how painful would you say that is for you?
A 1.
Okay, perfect. So with laser hair removal, you do want to have some pigment to the hair, some darkness to the hair. It won't work on reds or blondes or grays. But the more you do it, you're going to do about 6, and on your next visits, it's going to hurt even less. So you'll see a change even with your first one, Chelsea. She's never had laser hair removal before, so she'll see a change with her first one. It will grow slower. There'll be patches, all of that. You'll come back every 4 to 6 weeks for your second, third, fourth, and fifth, 6th one. Okay. We'll do a couple more pulses, and then we'll move on to what's called photo reju. Okay, so next we're going to do what we call a photo rejuvenation. So this treatment is going to be for any kind of pigmentation. It is very similar to an IPL or a photofacial that you've probably heard of. The difference is we use a true laser. The wavelength we are using is going to target those brown spots specifically, where an IPL or a photofacial is a more wide range wavelength, which sounds better in theory, but it's not targeting the specific thing that you want it to. So I think that a laser works a little bit better for the browns and the reds, like the vessels in Chelsea's cheeks and then her browns here. You can do this treatment anywhere on the body. So any time we do a facial here at the Med Spa, it will always include your face and your neck. Your chest, your hands would be an add-on. You can do back. You can do anywhere that you have pigment that bothers you. So I'll go ahead and do a couple pulses on Chelsea so she can let you know what she thinks it feels like. So we'll go along. The difference with this compared to the laser hair is that it won't have any cold cryogen spray. You're wanting to heat those browns up and bring them to the surface. So here we go. So I'm just gonna hover right over those browns. Chelsea, how would you explain that feels like? What that feels like?
It feels like a tiny hot raindrop.
A warm wave raindrop, perfect.
Yeah.
And it's like on a scale from 1 to 5, what would you say?
Maybe a 3.
Okay, perfect. And again, with these treatments, as she loses pigment, it'll hurt even less. The laser's attracted to that pigment, so that's what's making it feel hot. Over the next week or 2, those spots will get darker and then they'll just shed off with natural processes of the skin. So there's really no downtime besides that those spots get a little bit darker before they get lighter. We can also treat the little vessels in the cheeks at the same time as your photo rejuvenation. It would have the cold cryogen spray while we were doing that. It makes it very comfortable, no big deal at all. Okay, so like I was saying, this laser also can help with any kind of redness in the skin. So again, rosacea on the cheeks, broken capillaries in the cheeks, everything red on your face we can help, as well as our spider veins down on our legs. So the laser, what it's doing is heating up that area, heating up that hemoglobin, and then your body just kind of gets rid of it. The laser is absorbed in that, and it can either help it go away all the way or make it look a lot better. We usually suggest 1 to 3 of these depending on the severity of the spider vein. So I'll go along here so you can see what this looks like. Again, the cold cryogen spray will spray out. So it's a tiny little spot size, and we're just gonna go right along what we're looking for is for them to get a little bit more red. I explain it kind of like a cat scratchy. So they're gonna get a little worse before they get better. And we reschedule them about every 10 weeks. And that is all.